Abdominal migraine isn't just a stomach ache. It's a type of migraine that shows up as belly pain, nausea, and vomiting, not head pain. It most often affects children, and it can be confusing, frustrating, and hard to recognize. Today, we'll walk through what abdominal migraine is, how to recognize it, what triggers it, treatment and prevention, and how families and schools can support kids who live with it. Abdominal migraine causes episodes of belly pain, nausea, and vomiting. The pain can feel dull or achy, and it ranges from moderate to severe. Episodes can last 1 hour to 3 days. On average, you're looking at about 17 hours. During attacks, kids may have nausea, vomiting, loss of appetite, pale skin, fatigue, and some may be sensitive to light or sound. And then what's interesting is that between episodes, they will feel completely normal. Abdominal migraine is mostly seen in children under 10. The average age of onset is around 7 years old, and it affects girls more than boys. Between 1 and 4% of school-aged children live with abdominal migraine. Family history is a strong clue. If a parent has migraine, there's a 50% chance a child will. If both parents have migraine, that jumps to 75%. What does an episode or an attack look like? Well, it can be sudden belly pain centered near the belly button, nausea, vomiting, pale skin, loss of appetite, a child who looks completely drained. The pain can stop school, sports, daily activities, things that mostly a child would want to do because it's fun. Abdominal migraine can prevent them from doing this. And then boom, just as suddenly it ends, and the child feels fine until the next episode. Getting a diagnosis can be hard. There's no test that confirms abdominal migraine. Providers rely on history, family migraine history, and ruling out other causes like Crohn's, IBS, ulcers, or kidney problems. We wish this wasn't true, but on average, a diagnosis takes about 2 years. That's because belly pain in childhood is so common. Making sure your healthcare provider knows your family history can help. Remember, migraine isn't just a headache. An abdominal migraine isn't just a stomach ache. You may be wondering what can trigger an abdominal migraine attack. Not every child has clear triggers, and sometimes attacks come out of the blue. Some common triggers are stress, poor or irregular sleep, skipping meals or dehydration, travel or motion sickness, flashing or sparkling lights, certain foods like chocolate, hard cheeses, processed meats, and caffeine, especially in higher amounts. Tracking all of this can help a lot. You want to note meals, sleep, stress, activities, and any food they're eating. Over time, patterns may emerge. So how do we even treat abdominal migraine? During an attack, rest in a dark, quiet room. A cool cloth or ice pack on the belly may help. Doctors may recommend NSAIDs like ibuprofen or aspirin and anti-nausea medications. Some healthcare providers might suggest triptans, which are migraine specific. You can see here a couple of triptans that are used in kids along with the ages that they're typically approved for. If vomiting lasts a long time, IV fluids may be needed. If migraine attacks are happening often or getting in the way of school, sleep, or daily life, your provider may talk with you about preventative treatment. These are medications taken regularly to help reduce how often migraine happens and how intense it feels. There are several options your provider might consider. You can see here some of the common medications used. You may want to pause the video and take a screenshot. And depending on your child's needs, there may be additional options to explore, which we've listed out here. Again, if you'd like to pause the video, take a screenshot so it's easier to have a conversation with your healthcare provider, please do so. There are also newer treatments becoming available, and you can ask about those as well. A healthcare provider will help guide these decisions. Just go in with this information and remember that you have power as the parent and guardian in this situation. You just want to find what works best for your child. The good news, about 60% of kids outgrow abdominal migraine in their late teens. But somewhere between 50 and 70% will also develop migraine head pain, either alongside abdominal migraine or later in adolescence or adulthood. That's why building supportive habits early is so important. So, what can parents and caregivers do? Believe your child, their pain is real. Keep track of symptoms and triggers. Share family history of migraine with providers. Create a pediatric migraine action plan. That way, you and your child know what to do, what medicines to use, and when to seek help. Share the plan with your child's school. That way, staff know what to expect and how to support them. You can download the plan in the description below. Migraine at School offers free resources for family and educators. Download our guide to prepare for a conversation with your child's doctor. Use our tools to track symptoms and share information with schools. Visit migraineatschool.org to learn more. Abdominal migraine is challenging, but with awareness, planning, and support, children can feel understood and cared for. And remember, you're not alone. Migraine at School is here to help.